Von Willebrand disease is a blood disorder that affects 1 in 100 people. Our blood contains many proteins that help our blood to clot when necessary. One of the proteins is called von Willebrand factor, also known as VWF. When there is a defect or deficiency of the quality or quantity of the VWF, it inhibits the ability for blood to clot properly. The VWF is composed of multiple subunits, which do two important things. The first one is it binds to clotting factor 8 in our blood circulation, which protects it from being broken down. Secondly, it helps platelets bind to the inside of injured blood cells, which are able to form a blood clot and stop it from bleeding.
The first type is the mildest type and includes about 70 to 80% of cases. Patients with type 1 von Willebrand have low levels of the von Willebrand factor and experience symptoms like bruising, nosebleeds, heavy menstrual cycles, and mild bleeding. There are three main types of von Willebrand disease, each with different degrees of severity and inheritance patterns. Type 2 von Willebrand disease has 2A, 2B, 2M, and 2N. Patients with 2A have reduced von Willebrand factor that fails to bind to platelets. This reduces the ability of platelets to come together to form a clot to stop the bleeding. Patients with type 2A experience symptoms such as mild to moderate mucocutaneous bleeding. Patients with type 2B have platelets with an increased ability to clump together, resulting in premature clumping in the bloodstream, rather than at the site of blood vessel injury. Their symptoms are mild to moderate bleeding and are also at risk of developing thrombocytopenia, which are reduced levels of platelets in the blood. Patients with type 2M have a decreased activity of the von Willebrand factor. This results in the von Willebrand factor failing to interact with platelets, making it harder for the platelets to bind to the inside of injured blood vessels. This means that there is no blood clotting, which makes it harder to stop the bleeding. In some cases, more severe bleeding will develop. Patients with type 2N have the von Willebrand factor protein, but it fails to transport factor 8 to the site of injury. Patients also have reduced levels of factor 8 in their blood. This becomes problematic because factor 8 contains many blood clotting proteins necessary to stop the bleeding. Without it, individuals develop excessive bleeding following surgery or dental procedures. The last type of von Willebrand disease is type 3. Type 3 is the most severe type of von Willebrand disease, and only about 5% of patients with von Willebrand have type 3. These individuals have a complete absence of the von Willebrand factor gene in their blood. They tend to experience severe bleeding, bleeding into muscles and joints, causing joint damage. They also have the development of multiple hematomas, which are blood clots that partially clot in an organ, tissue, or body space. Von Willebrand disease is caused by a mutation in the von Willebrand factor gene, which is located on the P arm of chromosome 12. The mutation occurs spontaneously or can be genetically inherited. In such cases, type 1 and type 2 von Willebrand disease is inherited as an autosomal dominant trait. In some type 2 and type 3, it is inherited as an autosomal recessive trait. The von Willebrand gene encodes for a VWF protein. Patients who have von Willebrand disease have a mutation on the VWF gene, which causes low level of von Willebrand factor proteins. Low levels of this protein is the reason why blood clots take longer to form and symptoms such as excessive bleeding occur. The mutation of the gene can also result in a loss of function of the von Willebrand factor protein. When this happens, the von Willebrand factor protein fails to act as a glue to hold platelets together at the site of injury to a blood vessel. This causes platelets to not be able to stick to the wall of blood vessels, making blood clots break down prematurely. The von Willebrand proteins are also responsible for carrying factor VIII coagulation proteins, which are another group of related proteins essential in the formation of blood clots. Von Willebrand factor proteins prevent factor VIII from being metabolized as they move to the site of injury. However, when the von Willebrand factor proteins are defective, they fail to protect factor VIII proteins and result in the premature breakdown of essential blood clotting coagulation proteins.
It's important to know your family's health history and pay attention to any symptoms that may be associated with von Willebrand disease. Symptoms include abnormal or excessive bleeding, nosebleeds, heavy and long menstrual cycles, easy bruising of the skin, large blood clots, and symptoms of anemia like tiredness, fatigue, or shortness of breath. As of today, there is currently no cure for von Willebrand disease, but treatment is available. Treatment is given to patients considering their age, overall health and medical history, severity, tolerance to medication, and preferences. One of the most common treatments given to patients with von Willebrand disease is desmopressin. It is a synthetic hormone given through injections or nasal spray. This synthetic hormone causes an increase of von Willebrand factor in blood vessel cells. For patients who do not react well with desmopressin, need therapy for extended time, or have severe injuries, they are given von Willebrand factor replacement therapies. This is administered through injections directly into the veins, allowing replacement of von Willebrand factor in blood vessel cells. In some cases, patients are also given antifibrinolytic agents like aminocaproic acid or tranexamic acid. This is given to patients orally or through an IV. It is used to stabilize an individual's excessive bleeding and is able to manage nosebleeds, menstrual bleeding, dental procedures, and surgeries. One of the benefits of this treatment is that it can be combined with desmopressin or von Willebrand factor replacement therapy.
Hi, I'm Belle, and I have von Willebrand's disease type 1.
When were you diagnosed with von Willebrand disease, and what were the first symptoms that you experienced?
So I was officially diagnosed with von Willebrand's disease type 1 in 2015 when I was a freshman. The I'd say, first symptom that I had was back in 8th grade when I had a really bad nosebleed. It was probably going for 5 minutes, and I had really bad blood clots coming out of my nose. I had no idea what it was at the time, so I kind of just disregarded it and never went to the doctor to see what was wrong until I found a really big bruise on the back of my knee, and my menstrual cycle was really heavy. I had really bad cramps. I had really bad blood clots. When I went to the doctor, they diagnosed me as anemic, but clearly that wasn't the case. So they sent me to a hematologist, had to do a bunch of blood tests, and for me to get my results back, it took a while. But they finally diagnosed me with von Willebrand's type 1, and that was just the start of the whole journey that I had.
How has von Willebrand disease affected your life physically since you were diagnosed?
I'd say on an average basis, it hasn't really affected me too much, but just when it is that time of the month, like my menstrual cycle, I do bleed a lot more. So that causes me to be more tired, or my cramps get really bad. So I just want to lay in bed all day. And I feel like that's just not me being productive. With my bruising, I do bump into things. I do find bruises here and there, and they do take longer for them to heal. Or when I'm at work, I do get cuts, and they just take a little longer for them to heal, or I'll just be bleeding excessively. But other than that, those are things that I have to deal with having the von Willebrand's disease.
Are there any limitations due to you having von Willebrand disease?
Yes, I can't take certain medications. I can't take Advil, Midol, Pamprin, just things like that. Also, if I were to get a major surgery, like getting my wisdom teeth out or something, I do have to show a card that says the type of von Willebrand's disease I have and things like that. Also, getting tattoos, I have to make sure I tell them I have a blood disorder just because you bleed a lot more, but I do have them, so it's not that big of a deal. But those are some of the limitations that I do have having the disease.
Okay. How do you go about treating von Willebrand disease?
So people with type 1 have a nasal spray. It's called Stymate. And if you're responsive to that, it does clot your blood if you're bleeding excessively. But in my case, I'm not responsive to it. But I've never been in a situation where it's been life-threatening for me to find an alternative. So I kind of just live my life day by day, other than having the heavy menstrual cycles, being fatigued, things like that. But I haven't been in a situation where I had to really find out what other medications I do have to take to treat it.
Von Willebrand disease is a lifetime condition, but with the proper treatment and support, you and your child can learn to manage its symptoms. One of the most sought forms of support is gynecologic support. Mainly, women reach out to their gynecologist to be provided with contraceptives like birth control, which help regulate and manage menstrual cycles. There are also many resilience programs in which you can meet other individuals with the same genetic condition. You can get together and obtain professional support. If you or someone you know with von Willebrand disease is in need of any support, they can always seek gynecologic or emotional support services.